Good afternoon. Welcome to Ask Dr. Icon. I am Dr. Karmen Wong. I'm a medical oncologist and the medical director of Icon Cancer Center in Singapore. The first question is actually very interesting. The question being posted is that this lady has some symptom pertaining to so-called ovary cancer because they are bleeding in between period. And she wants to know what test should she do and what is it all about. Now, I want to verify that bleeding in between period is not a symptom of ovary cancer. Rather, a bleeding in between period is a symptom associated with uterus cancer. Uterus is where the baby was being kept. The ovary is the egg basket outside the uterus. Therefore, when they have bleeding in between the period, and many a time one is worried about some pathology inside the uterus rather. But in either way, if you are concerned and one should go and consult a gynecologist, the very common test for them to do to rule out ovary cancer will include an ultrasound of the pelvis, either done at the clinic or by the radiologist. A very significant test called CA-125 or even CEA are tumor marker in some situation is being associated with ovary cancer when the level are very high. After being evaluated by your gynecologist with either the ultrasound and or the tumor marker, in order to establish the diagnosis of ovary cancer, some form of biopsy will be done, either by taking a fluid or taking a sample to establish that it is truly an ovary cancer. And at the same time, some tests will be done to find out what stage of ovary cancer this particular patient is in. Okay, the second question is a very common question being asked. This lady was asking, I have cysts in my womb. Now I need to verify the cyst in the womb is a cyst pertaining to the uterus. When we are talking about ovary cancer, the cyst is in the ovary. Okay, so the question to ask is that the cyst in the ovary means that one will be developing into cancer. Now I need to verify that the cyst in the ovary in a young woman is probably slightly different from an older person. And many a time a cyst in the ovary in a young woman is related to an ovulation or egg in the ovary and seen as a cyst. Sometimes endometriosis can be seen as a cyst around those areas. And many a time a very experienced gynecologist will be able to tell by doing an ultrasound examination. A cyst in the ovary in an older woman has a bit more significance because they don't ovulate anymore, so they have no more egg cysts and they don't have endometriosis. So many a time, a cyst in the ovary in the older population is more significant. And more so, ovary cancer is a much more common cancer among older women compared to the young. So therefore, in the presence of cysts, especially with a higher risk factor like family history of breast and ovary cancer, a woman who is relatively overweight, and a history of very early menses and late menopause, or a person never been pregnant before. Now, those are the risk factors that people watch out for. And in the presence of a cyst in the ovary, especially when one is older and postmenopausal, and you may want to seek medical advice earlier. The last question is a very sad question. They say that when we gain weight, that means that it is a sign of ovary cancer. And this particular lady say, I'm gaining weight, therefore am I having ovary cancer? Now this is a very tricky question because when one grows older, we always gain weight. So does ovary cancer cause a person to gain weight? The answer is actually not quite. Many a time ovary cancer grow as a mass. So therefore, the mere fact of the weight of that mass lead to the increase in body weight. And secondarily, the ovary cancer tend to produce water or fluid in the abdomen. And the fluid is seen as weight. 1 liter of fluid is 1 kilo of weight. So when they have more water or fluid in the abdomen, it is seen as increased weights the person is having. So many a time when a person is not fat and yet they look at their tummy, why am I having an increasing size of the girth of my abdomen? Not so much of weight on my arms and my leg. It's more so in the trunk, in the abdomen to see that am I pregnant, and I know that I'm not. And that is telling you that there may be something in your abdomen that is growing in size and maybe even producing water, creating a volume and a weight, and therefore to tell you that there's something not quite right. Now, when that happens, you tend to be telling us that the cancer is a little bit more advanced because it is getting bigger and it is producing water. So at the end, thank you very much for hearing me out. Thank you for sending me in of some of the questions that really bother you. And always remember being vigilant to our body. When you know that something is not quite right, go and seek help. And I do hope that some of the answer I have to your question have helped you to resolve some of the doubt and fear that you have over this ovary cancer. And always remember, when you discover anything that's early, the cure rates improve. And wishing you all have a very, very healthy body.